Hello, everybody. This is Councillor George Hall from the City of Calgary. I'm here today with Dr. Sajjad Fazel, who's a researcher in public health with the University of Calgary. And we're here to talk about the coronavirus myths and facts. Dr. Fazel?
Thanks a lot, George. I'm Sajjad Fazel, a public health researcher at the University of Calgary. I've been involved in numerous public health advocacy activities, including water fluoridation, tobacco control, and health promotion. Currently, my research focuses on COVID-19 misinformation, and we're looking at how misinformation spreads, what makes somebody believe in misinformation, and also how can we address and combat misinformation in our society.
Dr. Fazel, what are some of the best ways that an individual can prevent the coronavirus from spreading?
So that's a good question. There's several ways you can prevent yourself from being infected with COVID-19. The most important one is physical distancing, staying away from other people, staying away from crowds and areas that are closed where you have a bigger crowd. And the reason is because we know that the virus transmits from person to person through droplets when someone is talking, when someone is coughing, when someone is shouting. And so if you stay away from others, you protect yourself. That's number one. Number two, we also know that the virus travels and transmits from one person to another is when someone coughs and then the virus lands on surfaces and then another person touches that surface and then touches their face. That's how the virus spreads as well. So the recommendation there is to wash your hands frequently with soap and water. At the same time, to make sure you don't touch your face, you don't touch your eyes, your nose, your mouth, your ears. And even when you're wearing a mask, you do not touch your mask all the time and keep adjusting it. I think that's important. The third thing is to wear a mask. Now, while wearing a mask will not prevent you from being infected, it will prevent your droplets from going far enough and infecting others. So basically, you wear a mask to protect those around you, and they wear a mask to protect you.
Yeah, and I'm glad you mentioned the mask because there's been a lot of conversations that we've seen through the media in the US and even here on should we wear a mask or shouldn't we wear a mask? And I'm glad you touched on that. What about gloves? We see many people at the grocery store, some people wearing masks, some people not. Sometimes they're hanging on their necks or not covering their nose. You will see some individuals wearing gloves and some aren't. So can you touch on that as well, the importance of how to wear the mask properly? And is there a benefit of wearing gloves as well or not? And then can we wash the mask depending on the type of mask it is, or should we be disposing of it using another one?
Yeah, those are great questions. And those are the doubts that I've seen many people have as well. When it comes to the mask, the appropriate way of wearing a mask is, first of all, you make sure you wash your hands with soap and water. And then when you're wearing your mask, you touch the ends of the mask and you put it on, making sure that the bridge of your nose till your chin is covered. And you can adjust it at the beginning so that the bridge of your nose all the way to the bottom of your chin is covered with the mask. So that's the appropriate way of wearing the mask. And then in terms of removing it, it's best when you get back home, you remove it and then throw it directly into the washing machine if you can, or wash it with soap and water. Now, obviously, we are looking at cloth masks and fabric masks. When it comes to surgical and N95 masks, those have different procedures, and those are mainly advisable for healthcare workers because they are at a higher risk of getting COVID-19 compared to the general public. When it comes to gloves, it's a very interesting matter. So I've seen people wear gloves. So you wear gloves, and let's say you wear gloves and you're potentially protecting yourself, right? But you've touched surfaces which, let's say, have COVID-19. And then if you go back to your car and you touch your car handle and you open your car, you're already transmitting. If you're busy holding your steering wheel, you're already transmitting. Okay. If you touch your phone, so that glove, the function of the glove has already been nullified, right? So if you want to wear gloves as an extra precaution, you can. But what I would advise you to do is to make sure that by the time you reach your car, let's say after going to the grocery store, you actually remove the gloves inside out, and then you either dispose of them if they're disposable, or if they are winter gloves, you keep them aside, and then you can wash them later when you go home. But the thing is, we have to be cognizant of the fact that wearing a glove doesn't kill the virus. It just stops it from reaching to your hands. But then you have to keep in mind that whenever you touch any surface with the gloves, you're transmitting the virus as well. And so the best thing to do is once you remove it in the car or before you enter the car is to use a sanitizer to clean your hands, and then you'll be good to go.
And washing your hands is the most important thing, better than a hand sanitizer that I've been told. Wash most frequently as possible with soap and water for 30 seconds. So I'm glad you mentioned that.
Yes.
But I guess the appropriate use of hand sanitizer when you get into your vehicle and when you come out from a public place is also good. Thank you for that. There's one thing that I think a lot about, and all this misinformation and myths out there. I remember hearing, if you hold your breath for 10 seconds, you'll know that your respiratory system is in good condition. Or there's some saying, if you keep sipping on water, warm water, that helps prevent it. So can you talk a little bit more about all the myths you're hearing? And let's debunk some of those myths and some of that misinformation. And I know it's difficult with technology, the internet age, and it spreads very quickly. So can you comment on some of the myths and misinformation that's out there, and let's really debunk some of those?
Yeah, that's a great question. It's something that has been spreading. I mean, many people have seen this new pandemic movie that has been spread on social media that is filled with lies and inaccuracies, all the way from saying that if you wear a mask, it reactivates your own virus, to claiming that hydroxychloroquine is a miracle cure. This movie is full of inaccuracies, and it's good for everyone to understand that. But I think it's also important to be cognizant and aware of the fact that why does misinformation spread, right? And we do know that if you have a distrust for the public service or the system, you are more likely to believe in conspiracy theories and myths. At the same time, I think some of these myths and conspiracy theories are pseudoscience, which means they take a concept or a theory in science that is true, and then they bend it and morph it into something that is untrue. So, for example, we know famously that the President of the United States, for example, has said that you injecting yourself with bleach might be a good idea, right? Yeah. Something which is false. Now, we know bleach is a disinfectant. Undiluted bleach is a disinfectant which can kill COVID-19 if it's on surfaces. But that does not mean it will kill COVID-19 when you consume it. In fact, it will lead to liver failure and death to some people. So this is why I think we have to be understanding of where do these myths come from and how do they stem. At the same time, there are people who benefit from misinformation. Those who spread misinformation about miracle cures and immune boosting pills, they are making a quick buck by preying on people's fears and panic, right? At the same time, you have right-wing politicians in different countries in the world who like to say that this is all a hoax or this is not true. And again, they are getting this political win among their own followers by propagating this type of misinformation. And then the one-off celebrity or YouTuber who spreads misinformation gains that popularity among people who believe in conspiracy theories and myths. So I think we have to be aware that somebody is benefiting from it. So that is one way that it spreads, that you have people propagating it. The second way is when is just a way a regular person receives a post and they're like, oh, this is interesting. Maybe George or somebody else will be interested in this. Let me just share it. Without thinking, is it accurate? So I think the most important thing at a time like this, when you receive myths and when you receive any post related to COVID-19 especially, is to think, not to think in terms of, is this going to benefit someone? But rather to think, is this accurate? Is it true? And there's so many websites and resources to fact check it. In fact, if you look at the Public Health Agency of Canada, Health Canada, Alberta Health, the City of Calgary's website, as well as various institutions, they have provided accurate information. The World Health Organization, the CDC, they've provided accurate information on all their social media platforms. And some of that information is very easy to access and understand. And so I think we have to always fact check whatever we receive. It's our responsibility for all of us to become fact checkers at a time like this and see, is it true? And then to spread it around if it's true and beneficial. So yeah, I think that's one of the mindset.
And that's very important that you mentioned about how information is spread. I mean, I know from how many WhatsApp messages I get or text messages I get and how many videos I got sent to me to watch this. The cure to the coronavirus, or how to be healthy and what type of meds you can take or healthcare products you can take to ensure your health to fight this. So I'm glad you really mentioned that fact checking and really looking at is the information factual? Is it from a reliable source? What do you think we can do as a local government or as government to ensure the spread of misinformation does not occur? You mentioned that there's a number of websites, or how do we get out the message better? Both of us being from ethnocultural communities, it can be a bit more of a challenge because there's language barriers and comprehension of the information being provided. So what can we do better as a municipal government and other orders of government to help with getting the proper information out that's accurate to individuals here?
Yeah, and I think you have touched upon a very important point, that there is inequities in society when it comes to COVID-19 and just the healthcare system in general, right? And one of the inequities is this, getting the right information across. If you see most of the videos being created, most of the information out there, all the way from WHO to some of the other governments who work in this space, they're mostly in English. Of course, WHO and Health Canada have done certain work in translating the knowledge and getting it across. But I think more needs to be done. And as a municipal government, this would be the right place sort of to take the center stage, because every councillor is connected to a particular area and a specific area, and he understands the people who live in that area and what problems they are facing, the languages they speak. And it would be a right time, not only in terms of translating the content, but also creating content that resonates with that people, right? In terms of racially, religiously, in terms of the ethnicity. So if, for example, and I'm just going to give another example. So if you look at when we talk about a balanced diet, for example, if you look at someone talking about a balanced diet, if you look at resources from the WHO, they mostly cater to the Western diet. But that wouldn't necessarily work in African or Asian countries because the diet is different.
That's right.
So when you want to present the balanced diet in those countries, you have to make sure the graphics that are produced show the foods within that country and how they can maintain balanced diet within their lifestyle. So I think this is where you see the tailoring of message come, and I think this is a point where the municipal government and the local councillors as well can play a major role, and something that I've seen you have been doing.
Yeah, and I think I represent a very diverse ethnocultural communities and many faith groups in Ward 5, where stats show that 2/3 English and French is not their first language. Wow. And these are some of the challenges that I see within our communities, is getting the right message out so people understand it. And just like you mentioned, the diet. Right. I mean, a lot of people will eat roti or naan with their sabji, their vegetables and lentils.
Yes.
And that might be a part of their diet.
Correct.
We've also it's been quite challenging this year with COVID-19, as we've had a major impacts within our ethnocultural communities with, for the Sikh community, for instance, it was Vaisakhi and large celebrations, and it's a great opportunity to get the right messaging out, even in the Muslim Islamic faith with Ramadan this month. And so there's a lot of challenges that many of our communities are facing with that. And I'm glad you were able to touch on that. And we need to do a better job as government from all levels of government. But, at the municipal government, we're the ones directly connected with the people. And that's where I think we need to have an opportunity to ensure that we are getting the right information out to those communities in the appropriate manner. So we're not targeting specific ethnocultural communities that we see that the virus has hit for whatever reason it may be, that we are getting the right information out, that we're all working hard to combat this together.
And it's also helping and supporting to build community resilience, right?
That's right.
Which is the role of local government at the end of the day.
What are your, a lot of talk has been on reopening the economy. We've seen it from the last number of weeks. We've seen the Premier here in Alberta, Premier Kenny, talk about May 15th as a date. And I know in Calgary, we've had a larger number of cases. So we're looking at some reopenings now, but the 25th being the opening. What are some of your concerns about this? And then how do we monitor, is the reopening effective? Can we go from phase 1 to phase 2 to phase 3? And what do we have to look at to take that next step? Or what may cause us to take a step back? I guess what type of message can we give out to everybody who's listening to us today on what they need to do and ensure they keep doing, but also the impacts of the opening of the economy? If you could talk about that a little bit from your perspective.
Yeah, and I think you raised an important point, because that's what's going to happen now. We're going to slowly start reopening and relaunching. And the goal at the end of the day is to manage the pandemic and control the virus with the least amount of impact to the community, right? With the least amount of impact to people's livelihoods, income, and routine. And so it is important to relaunch, but at the same time, it's important to understand that we shouldn't forget the lessons we learned during COVID-19. So, for example, one of the main lessons that we learned during COVID-19 is hand hygiene. I mean, we do know there are several people in the community, in the society, who don't regularly wash their hands. And I hope this is something we take on forward, that hand hygiene has to be an important part of our daily life post-COVID-19. Similarly, I think it does draw importance to how much we interact and how often we meet each other, right? While we are we are social beings and we want to meet each other and go out often, I think it's important to realize that when you leave your house, it's good to keep a plan in mind. Am I going to the grocery store? Am I going to finish everything else and then come back home to reduce my chance of exposure? At the same time, it does bring out a new way of doing business, right? Because now you have restrictions in place. Restaurants will be only at 50% capacity, for example, at least for the time being. And these are things that we have to keep in mind in terms of how do we support local businesses, how do we support local entrepreneurs at a time like this. In terms of how we will progress to the next stages, I think it depends on seeing, first of all, the total number of cases, and especially the new cases. Do we have increasing number of new cases? Do we have outbreaks in certain areas? And if that's reduced, we will be able to progress to more stages and open up slowly even those wider, large gatherings in time. But it is upon all of us to be cognizant that during this time of stage one, where we are slowly opening up certain services and facilities, that we do not overcrowd, we do not go against the public health guidelines. We should be cognizant that COVID did happen and an outbreak can happen at any time, so we have to be careful. Whenever you're in a crowded place, wear a mask, wash your hands, and try to keep distance wherever possible.
Yeah, and that's something that I've learned is, coming from, I've been being born and raised here, playing lots of sports and being, I'm a social person. I like to be out with my friends to be able to play sports. I like to see my colleagues at work. I like to interact with people. And so I think a new normal for me has been to keep this distance. Rather than shaking hands, is to do an elbow bump, if anything, or put our hands together like we do in a lot of South Asian countries, right? So there's many ways to, I guess, to greet somebody without having that physical contact. And I think all of us have discovered a new way to socialize using our phones,
yes.
FaceTime, calling people, having that direct conversation and interaction, but also using other forms of technology and being able to work. One thing that does concern me has been, as we open our economy and with schools being closed, I know we can open their daycares or some limitations, but
yes.
This school year ending, is the amount of technology that we see of many of our kids on, the impact on the mental health of those kids and their well-being, their physical well-being, because in schools they get a lot of physical exercise, but also their mental and well-being as well, and the importance of socialization. Have you thought about that, or have you looked at the impact on that and what we can do as a community to help, I guess, a lot of those members, those youth members in our community to get through this as well?
Yeah, it is an important point. I think I was looking at a couple of studies, and there were some that mentioned, it was even a poll that was done, that a lot of Canadians are more stressed right now. There's more mental health sort of worries among themselves. Depression has increased, and it's also because, again, those people who used to go to the gym, for example, now they can't anymore, and they won't be able to in quite some time. Doesn't mean you can't exercise at home, but then it's a different structure, right? It's a different way of life. And I think as we go into this opening stage, we have to try to reprioritize our life. So, for example, if you go to to a sit-down restaurant compared to a grab and go, you are at a higher chance of being infected with COVID-19, even though the restaurant is at 50% capacity, because you're spending more time with people in an enclosed space. You are, again, more safer to go to a park than to go to an indoor recreation facility. And that is why the province isn't going to open an indoor recreation facility anytime soon, right? So I think it's good to reframe and prioritize how we go forward. In terms of the education and mental health for children, it would be good to have programs for children. So I have seen certain communities arrange programs for members of the community. So if there would be a teacher or an educator who's working with children or daycares, then they would have a Zoom session with kids. I've seen this done in a community in Toronto, actually.
Okay.
And then I've also seen the same community have mental health discussions with various people at home. They would have chit-chat sessions with the elderly. And this would be in Hindi, actually.
Okay.
Yeah, so it was for an
Right.
for an ethnic community. It was pretty interesting to see that. So I think such type of programs need to be developed, and schools can embrace more technology and distance learning. And these days, it's very easy to work with technology, and the kids these days are actually more tech savvy than the way we were during our time. So I think it's a good point and a good place in society to innovate.
And I think I'm glad you mentioned that, innovate, because we've seen a lot of innovation now. Even a lot of our, I have 3 girls, they all play soccer. So they've been doing those Zoom classes at home, which a lot of the soccer clubs have been providing
Very nice.
to anybody who wants to participate. But now we're talking about being able to, as a group, while maintaining that physical distance, being able to train with your team potentially, but keeping distance. So you could do dribbling skills. So it's like rather than a Zoom session, you're doing it in a large field.
Yes.
Making sure you have the appropriate space. You cannot come in contact with anybody else's ball. So use your own ball with you, but you're in a larger group environment.
Correct.
And so I think that will be something good to see rolling out, to get those kids outside and getting some exercise. But also the innovation and how a lot of these organizations are going to adapt to the new reality until we get a vaccine or further antibody testing. And I'd like to know from your research on how much time would a vaccine, what are we looking for a vaccine moving forward, and the antibody tests that we also hear about, that if you've got COVID, not everybody knows that they've even got COVID-19, that if you built up antibodies, the impact of that, and how long will they last? And then a vaccine. What's the outlook on a vaccine moving forward from your research?
So we do know that Health Canada has approved an antibody test. I think the rolling out, we're still not yet at that stage of rolling it out. Yes, that would help people understand that they have antibodies for it and therefore they are immune. How long they are immune for, we don't know yet. The research is still going on. But we know that they'll have immunity at least for a short period of time, is what we can say so far. In terms of the vaccine, if you look at it, there has never been vaccine created as the way we expect it to be for COVID-19. It has never happened before in the past. It would take years and years to get a vaccine, right? Because you have to make sure it's safe and effective for everyone. Now, the thing that we are hoping for currently, because a lot of these vaccines are undergoing clinical trials also, and some of them have already undergone preclinical studies. What we are hoping for now is that we may be having a vaccine within 18 months from today. So again, up to 18 months, there's going to be certain restrictions here and there to make sure we don't have outbreaks spreading. But up to then, I think it should be around 18 months. And that would be the earliest it has ever happened in society.
And the antibody test, there's been a talk about that. Are you aware of extensive testing that may come forward to help do that? Is that something that you've heard more about? Is something I've heard a little bit on television and from many news sources about that could help identify who's had it and who doesn't have it. And then the app, I guess the Alberta government's brought forward to do some of that tracing as well.
Yes.
The importance of downloading that app and using that app. Can you touch a little bit on that?
Yes, and I think I'd like to cover that. That's a very important point that you brought up, especially right now when we will be reopening the economy. Everyone will be going outside. It's important to understand if somebody gets infected, who they came in contact with, which is not very easy, right? Especially if you're in a mall or you went around in an Uber. So I think it's important for everyone to download the Alberta tracing application. It's available on Android and iOS as well. It uses your Bluetooth. You have to have the app on. You have to be on the app. But it's okay. You can cover your phone up so that it doesn't use a battery. But I think that's the important part, so that whenever you are in close contact with somebody who, again, has the app, it automatically registers that you have come in contact with this person. You won't be able to see the person's name or phone number or anything like that. It's an automatic encrypted system. And then if you ever test positive, it's easy for the contact tracers to know who you have come in contact with and sort of contact them, tell them, okay, you need to self-isolate. And that's the whole point also of the antibody test. You know who is immune, so you know that they are pretty much, to a certain extent, safer compared to those who never got the virus, who are at higher risk.
Dr. Fazel, debunking some myths. Can you talk a little bit more about that?
Yeah.
I know you touched on it earlier, but I really want to get into a little bit more of that conversation. I think it's really important.
So if you look at it, there are a variety of myths. There is one group of myths which are miracle cure type of myths. So this is, say, eating garlic prevents you from COVID-19, drinking honey and lemon prevents COVID-19, drinking bleach cures COVID-19. So some of these myths again stem from pseudoscience. Is it out of the ordinary that somebody thinks garlic may have an effect? No, because we do know that grandma always says eat garlic and drink honey, right?
That's right.
It's going to help you with a sore throat. And while honey is known to have a soothing effect for a sore throat, it does not cure or cannot kill COVID-19. So I think that's the understanding that we need to have. That's this immune boosting type of myths. And then we have the myths that this is all a hoax, this is a bioweapon, and those myths are also false. Scientists have done research and have found that COVID-19 came from a natural source, then it was transmitted from animals to humans late last year in China. And so thinking that this is a bioweapon or it's a hoax, it doesn't exist, it undermines the public health system and it makes people think that they are immune to the virus. So these are the different false myths that are there, and I'm pretty sure that some more false myths, I will be sharing resources with you and your team that you can put out on your various channels.
And I'm glad you mentioned that on what else can we as governments do and what else can you advise to improve our public health? I think you've touched on it about some of the good things that help build your immune system. So getting exercise and maintaining a healthy body weight, eating well, those are all important things. What else can we do, I guess, from a public health perspective, from government and as individuals, to improve our health?
Yeah, so I think the first thing comes to information, right? Information is key. So for governments to provide accurate information, to tailor the messaging accordingly, and for individuals to make sure that they understand this is accurate information and to take on to practice it. It's okay to read something. If you don't practice it, there's no point, right? And as well as for individuals to adhere to health guidelines. Similarly, I think the other thing that we have to keep in mind is that there is fear and panic in the community, right? Various people are worried and stressed out. And this, while we are physically distancing, this is the time to come socially together. Right. And I think this is where government, local government plays a big role, right? Making sure that voluntary organizations get volunteers, making sure that local businesses get to run in a safe way and employees are safe, but at the same time, creating that sense of community and making sure that even though we are away from each other, we give each other a call, we help each other out. And something that you do, I've seen that to reach out to various people, various constituents, and sort of discuss with them what issues they're having. I think that is very important at a time like this.
And I want to acknowledge actually that one thing that I've seen is a tremendous response from community, from individuals, from businesses, from community associations. In our ward, I know the Dishmish Cultural Center has been doing a tremendous job getting food out to people in need for food hampers, the food bank here, the Muslim Council of Calgary. So many organizations that I've seen have done a tremendous job helping support Calgarians in need. And I think it's an important time for neighbors to continue to help neighbors and do everything you've touched on. A final question for you.
Right.
What do you enjoy about your work? What's your favorite aspect of what you do, what you get to do on a day-to-day basis? You have a lot of knowledge on these issues, and I've learned a lot today. But tell me more about, what the good doctor really enjoys, and what's the favorite part of your work?
Yeah, so I think one of the parts of public health research that I enjoy the most is the knowledge translation and communication piece. When we actually take research that has been done, the data, the finding, and the results, and we translate that into bite-sizable chunks that people can actually understand and put to practice, that's the part that I enjoy the most. It's okay to have research and have it sitting on a shelf in a journal that the public cannot access, but it's a different aspect when you take that knowledge and then you make it available to the public in a way that they can actually change behavior and improve their health by taking it into their own hands.
Thank you so much, Dr. Sajjad Fazel. You've been an amazing resource for us today, and thank you for the work you're doing with the University of Calgary and the great research you're doing in public health. I know I've learned a lot, and I know everybody who's had the ability to watch this will gain a lot of knowledge from this conversation on the coronavirus myths and facts that we were able to discuss today. So on behalf of Ward 5 and all Calgarians, I want to thank you for taking your time out today to bring this important message forward.
Yeah, thanks a lot, George, and thanks for organizing this. I've seen some of the community work you have done in terms of bringing people together socially and ensuring that they always have an ear to who listens to the issues that they face in this time, especially with some of the fear and panic that goes on and uncertainty. And I think everyone within your ward is appreciative of the things you do.
Thank you. I just want to let everybody know that if you want to get in touch with me, you can go to my website, georgechahal.ca, or send us an email at ward05@calgary.ca. You also can contact us at our social media at Chahal George. Any further questions, comments, we look forward to hearing from you, and we also can provide those to Dr. Fazel and connect you with him as well. Thank you so much.